All right, so we're going to do a quick run through of the integumentary system. The integumentary system is our system that consists of the skin, hair, and nails. And that's the main thing you want to remember: skin, hair, and nails. And of course, it also includes sebaceous glands, sweat glands, and this what they call subcutaneous tissue and nerve endings. So our nerves are in the skin as well. But all of these things, the sebaceous glands, the sweat glands, the subcutaneous tissue, which means under the skin, and the nerve endings are all in the, part of what we find in the skin. And the main goal of the integumentary system, it does many things, but one of them is protective covering. So the skin is a natural protective covering or an integument. So integument is the word for natural protective covering. The skin is the largest organ in the human body. What does the integumentary system do? Well, it protects our internal organs from injury. It protects the body against bacteria. It prevents the loss of too much water. It regulates our body temperature. So when we sweat, we cool down, and when we shiver, we warm up. But when we sweat, that sweat helps cool us down. It's a sense organ. Remember, our skin helps us feel things and experience things. And it responds to heat, cold, pain, pressure, and touch, right? That's what we feel. So it helps us make sense of our environment. It excretes waste products in sweat. So when we sweat, sometimes we get rid of a little bit of waste products as well. And skin also helps with the production of vitamin D, which is really important for our body. Normal changes of aging in the integumentary system is that the amount of fat and collagen in our body decreases. The elastic fibers in our body lose elasticity, so they're not as stretchy. Hair and nail growth slows down. Skin becomes drier. And especially for our elderly people in long-term care, it's important to remember that skin becomes thinner and more fragile. The protective fatty layer of skin gets thinner, hair gets thinner and turns gray, and brown spots may appear on the skin. All of this is natural and normal. Now, let's talk about some disorders of the integumentary system. An open wound. An open wound, so wounds are like injuries. An open wound is a type of wound in which the skin's surface is not intact. So it's open. And remember, with infection, an open wound is how the infection gets in, which makes it a portal of entry. A closed wound is the type of wound in which the skin surface is intact or is not broken. So that would be an example of a closed wound would be a bruise. So a bruise is often purple, black, blue, sometimes even red. And it's a leakage of blood from broken blood vessels into the surrounding tissues. A bruise is also called a contusion. So treatment of an open wound is going to be to stop the bleeding, clean it, and apply a dressing. So this treatment here would be for an open wound because a bruise is usually a closed wound. Okay, burns. That's another disorder that can happen in the integumentary system. Burns have different levels of severity. And we use the words first degree, second degree, and third degree to describe how severe burns are. First degree burns are superficial. So they only go to the outside, the top layer of skin, which is called the epidermis. And a first degree burn causes redness and pain. So a first degree burn is mostly mild because the epidermis is the outer layer of skin. A second degree is called a partial thickness burn because the second degree burns affect the dermis. So the epidermis is on the top, and then the next layer in is the dermis. So a second degree is partial thickness. It affects 2 layers of skin and causes some skin damage, redness, pain, swelling, and blistering. Then the most severe burn is the third degree burn. The third degree burn is called a full thickness burn, and it affects the epidermis, the outer layer, the dermis, the layer underneath it, and even deeper, it affects the underlying tissue and causes serious scarring, which may affect muscle and bone. The skin might be white or charred like charcoal, like blackened. There will be pain, swelling, and peeling skin. So, first degree burns are often mild. Second degree burns can be moderate to a little bit more severe, and third degree burns are definitely severe. All right, so we're looking at some pictures here. They're a little rough. Here we've got a first degree burn, which is sunburn. Here we've got a mostly first degree, maybe a little bit of second degree burn, where we see a little bit of this underlying tissue is affected, and it's bubbling up with a little bit of a blister. Here we're starting to see some third degree burning where we see that whiteness there. It's going deeper in, and this is definitely a very severe third degree burn in which it's going all the way down into the deep underlying tissue. So here we see that it's just the first layer of skin that's affected here in a sunburn. Here we're getting to the first and second layer of skin. Here we're going even a little deeper, and here we're going all the way full thickness into the underlying tissues. Okay, so burns and scalds. A scald is when you are burned by hot water. So the causes of a burns and a scald are fire, hot liquids, warm water applications, like if they're too hot, if the water is too hot, that would be scalding. Electrical equipment can cause burns, and of course, hot objects and some chemicals can cause burns. Severe burns may require surgery. Another thing, a severe burn can cause a resident's condition to deteriorate rapidly. Deteriorate means to get worse. So a resident who is not super strong and healthy that gets a burn may get worse very quickly because the burns is very, very difficult for their body to deal with. Burns are painful, so nurses have to offer pain medication before they begin the care. But remember, the CNA does not give pain medication. Definitely, if anyone has a burn, you have to be extremely gentle with moving and positioning. And another thing you need to do is report pus or other fluids around the burn area. So if you see any kind of discharge or fluid or infectious pus, that yellow stuff, around the area of the burn, or if the person is complaining of pain, you need to report that. All right, dermatitis. Dermatitis, itis is the suffix, right, the suffix at the end of the word for inflammation. So derm means skin and itis means inflammation. So dermatitis is inflammation of the skin. There are many different types of dermatitis. One type is atopic dermatitis, which is eczema. And there's also contact dermatitis. The causes can be stress, allergies, sometimes genetics, a family history of this kind of skin condition. Irritating agents in the environment. So sometimes things in the environment can cause dermatitis. The treatment would be steroid creams, soothing, or certain lotions. And if someone has dermatitis, you would report when it gets worse. If you would report severe itching or pain, and definitely, as always, you report signs of infection. Now here's one that we've probably all heard of, cellulitis. And I think a lot of us think that cellulitis is just, the extra fat cells that we might get around, often we get them in the legs or near that, near your bottom. But cellulitis in the medical world is a skin infection caused by bacteria moving into the tissues due to a break in the skin. So if you have a wound and bacteria move into the tissues and you get that swelling and infection here, that's the medical term for cellulitis. So remember that itis suffix, meaning inflammation. So here we've got a skin infection that happens when bacteria gets into a break in the skin. All right, scabies. Scabies is a condition. It's definitely an infectious, contagious situation in which, in this case, a mite, which is like a tiny, almost microscopic little animal, parasite, burrow into the skin to lay eggs. Yeah, scabies are a little bit, they're not something we want, right? So scabies are a parasite and they cause rash, intense itching, and sores that may become infected. And they are contagious. They are transmitted by contact. So contact transmission from person to person. They are very contagious, and the elderly and those with weak immune systems are at higher risk. The treatment for scabies is a special lotion that kills them. So if there are scabies, this is contagious, and we need to do contact precautions. All right, let's see where the next thing takes us. There's some pictures of an example of something that could be caused by scabies. Okay, so you see the itch, you can see the itching, you can see the mites burrowing under the skin, and you would use a lotion to get rid of that kind of infection. The good news is the lotions work. So that's what you'll do, is use the lotion to remove the infection. But if you see anything like that, you're going to need to wear probably gloves, right? And be very careful with your contact precautions. All right, we're going to stop here and we'll start with shingles in the next video.